I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello, and welcome to this episode of IDD Health Matters. Can't wait to introduce you to our guest, Richard Chapman. Richard, welcome.
Thank you. Thank you, Craig. Thank you very much.
So Richard, just tell us about yourself and the work that you do.
Yeah, Craig. First off, thank you for having me on the podcast. My name is Richard Chapman, and I am the Assistant Director for Disability Leadership at the Partnership for People with Disabilities in beautiful Richmond, Virginia.
Richmond, you said? Yeah.
And for Virginia Commonwealth University. I've been there since July of 22. I'm trying to figure out how to do the math. I have a couple roles at the partnership, but my story in the IDD health space goes back a couple years. I am a practicing mental health counselor, so I do psychotherapy for persons with disabilities in their family, among other things, addictions, trauma, some general mental health issues, and I focus on a big emphasis on my research is in the area of self-determination for persons with disabilities. And how I define self-determination.
I was going to ask you that because you and I know what that is, but I'd love for you to explain that.
Yeah. So how I define self-determination, and I don't have time to do a 3-day talk on self-determination. So we're not going to do that on the podcast, but it basically the ability to make stuff happen in your own life, to set and work toward goals in your own life. And we know from the literature that self-determination leads to a high quality of life for persons with disabilities.
It leads to a high quality of life for anybody when you really think about it, because we want to live the lives that we want for ourselves, right? And that's true for everyone. And I think sometimes, we don't think about that maybe for everybody.
Yeah.
And I know that supports and services for people with disabilities has always been a little too heavily, reliant on what others think that we should do for people with disabilities, rather than talking to them and saying, hey, what do you want for your life?
And too heavy on the medical model.
On the medical model, trying to fix it.
And I'm not bringing it up because I know you're a family physician, but
that's it's still very relevant and very appropriate, because we all need health care. You're not talking about, hey, we shouldn't have health care for everyone, right?
No, I mean,
we're talking about that we don't see the disability as a problem that needs to be fixed.
I believe that health care and mental health care is a right for all people, especially people with intellectual and developmental disabilities. We know from the literature, from the research, that there's a significant amount of healthcare disparities for persons with disabilities. And I really think that is unfortunate because I mean, if we go back to the COVID days, and I feel like I'm getting on a tangent, but I'm gonna get on a tangent for a second. If we go back to the COVID days, and there is this idea of rationing of ventilators, and people saying, "Oh, you have IDD, or you're a person with Down syndrome. You can't have a high quality of life. So we're in the pandemic. Why don't we ease your comfort?"
Richard, that's something I talk about all the time. We did see that in the pandemic, and while it's hard to say, well, good things came out of the pandemic, but one of the things that came out of that is a recognition that, you know what, we should not be deprioritizing anyone or making a judgment on somebody else's quality of life and deciding who gets life-saving measures and who doesn't, based solely on something such as a disability. And unfortunately, we saw that, and people had to be reminded that that is actually against the law.
Against the law, against ethics,
ADA,
against all that stuff.
Yeah. So what are some of the things that you're working on right now in the work that you do?
That's good, Chris. I work on a lot of stuff. I am working on the big thing I'm doing with colleagues of mine around the country right now, and I do a lot of work with the University of Kansas and the University of Kansas Medical Center is trying to understand this intersection between self-determination and mental health. We have hypothesized, and we have written this up in several articles, and I will email you the article.
Please do,
so you can put it in your show notes. I don't know the lingo. I don't.
You said it better than I would.
I don't know the lingo, like I said. But we have hypothesized, and now we're trying to show a causal relationship between self-determination and mental health. And we think that when we increase self-determination in persons with IDD, this in people in general, this will lead to a decrease in something of psychopathology and in a increase in overall quality of life.
It makes sense to me, and I'm pretty sure you're gonna find some good evidence to support that.
It makes sense to me. And we have a project that's funded by the National Research Consortium on intellectual disability and mental health that is trying to show this relationship, and is trying to set up a intervention. So we are excited about this project. My research team is definitely excited about this, and it's a 2-year project, and we're really just beginning the project. And I have a lot of ideas. I wanna see, does this translate into the non-IDD population, and we need additional funding. Does this translate to persons with severe mental illness and all that stuff.
Well, I'm looking forward to seeing the results of that.
Yes.
Yeah, that's exciting.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things that I do on the show, Richard, is I ask people to, I call it 3 and 3. Give us 3 things in 3 minutes. And I'm not going to hold you to the time, but 3 things that you think could really be impactful to the lives of people with intellectual and developmental disabilities, that can improve health or can improve mental health, or however you want to approach it. But 3 things you'd like the listeners to know and to understand that you think can really have a positive impact in this field and in the world.
Yeah. So first thing is be inclusive. We are getting away from a institutional support paradigm and be inclusive. And I know a lot of your listeners work in group homes and all that stuff. And so I was on a work group close to 15 years ago when I was a senior in college at the University of South Florida, and I have the issue of living supports and community living supports is definitely a complex issue for persons with intellectual and developmental disabilities. And I know some of the people might work in a group home, but it's like group homes could turn into mini institutions.
Oh yeah.
And I'm trying to be very careful because I don't want to say people that work in a group home, they're bad people. No. But look at ways to make group homes a little less mini
institutions, to make them
make them really community based and inclusive. And like I am thinking that we need to get rid of institutionalization. Second thing, and I'm just on a big kick right now as a mental health counselor, is the issue of polypharmacy.
Ooh,
and
it's a big one.
Yes. It's a big concern of mine.
So polypharmacy is when people are on many medicines, way too many medicines, often medicines that they don't necessarily need.
Yeah.
Yeah.
And we need to be careful of that. And by the way, I'm counting along with polypharmacy, and this is my second one. Still on my second.
Okay.
I'm doing this a little bit differently. I'm not really answering the question. We need to decrease the use of restraint and seclusion for persons with disabilities, and I think, and I keep telling my colleagues this. I say I haven't met a person that has a more complex support needs that we need to restrain and include them. Now, we obviously need to keep people safe, but I think there are ways to keep people safe without restraint.
Tying them down.
Without tying them down. So I think in one of my areas that I want to work towards is a restraint-free service system, and I think that is definitely a goal of mine. In my lifetime, restraint-free. We don't want to talk about shocks, my opinion.
Yeah, okay. We may not even want to get there. Right?
We're not going to get there, but any aggressive practice is not. It's never.
It's not the answer.
It is not the answer. And then my last thing, and I'm going to do the same thing. I'm going to combine a couple ideas. We can do psychotherapy with persons with IDD. We need to be able to do that. And then and I think we also need to promote self-determination for persons with disabilities. That is the solution.
I can't disagree with that. Richard, I really, really thank you for taking the time to talk with me today and sharing your insights. And I'm looking forward to getting the papers from you and to seeing the results of your work. Hopefully we'll get a chance for you to come back and talk about those later on.
Yeah.
All right. Great talking to you, Richard.
Thank you.